So I just wanted to take a minute to talk a little bit about social media. There is a lot of stuff out there that sort of makes me raise my eyebrows sometimes. And I think the thing that people have to remember is that social media is a marketing tool. It's not a way to search for surgeon qualifications. So remember, you're looking for a surgeon, somebody who's going to assume your care and take you to surgery. And so you're not looking for an entertainer. And I think these things kind of get intertwined sometimes. Not to say that there aren't good surgeons out there that are entertaining. However, that should really not be what you're looking for when you're looking for somebody that's going to take care of you and walk you through this important process and what sometimes can be complex procedures. So when you're looking for a plastic surgeon, you want to make sure that they're properly trained. Have they done a residency in plastic surgery? And if so, are they board eligible or board certified? Board eligible usually just means that they've completed the necessary training, but they haven't been in practice long enough to be board certified. It does take about a year after you've completed your residency to gain actual board certification. There's a required process that you have to go through. So generally the residency for people is 6 to 8 years of plastic surgery training, either a 3-in-3 general surgery and plastic surgery combined program, or a 5-year residency in general surgery followed by an additional 3 years, 2 to 3 years in plastic surgery. So it just depends a little bit. There's different tracks to get there. But both will get you board eligible so that you can sit for the board exams. Sometimes there's a lot of confusion that's created by different boards that are out there. And what you want to look for is somebody who is certified by the American Board of Medical Specialties. It's the oldest board out there. There are 24 different members from every type of physician out there. There are subspecialties within those categories, but the main thing that you want to look for is somebody who is board certified by the American Board of Plastic Surgery. So there is another board certification out there called the American Board of Cosmetic Surgery, and the qualifications for that are very different. You can obtain board certification through that process if you are any licensed physician. So you don't necessarily have to have any surgical training at all. You can be family practice, radiology, emergency medicine, anything you want to join and become a member of the American Board of Cosmetic Surgery. So very different process, very different qualifications necessary to get there. So just be cautious about this. The other thing I see a lot of is people doing cosmetic surgery will say that they're board certified, but they won't say what they're board certified in. So make sure it's not a board certification. One of the things we talked about, dermatology or internal medicine, something that really involves no surgical training at all. So just be careful when you're looking at these things and make sure that you're getting what you think you're getting. Along the lines of social media, the thing that I've seen a lot of lately is traveling for plastic surgery. So people get all wound up in the social media hype and they want to travel across country to see these surgeons. As long as you're getting somebody who has adequate surgical training and is board certified, we're all trained basically the same way. So, you can most likely find somebody in your area who is similarly qualified to do your procedure. The concerns that I have about traveling for surgery, number one, I don't really have an opportunity to develop a rapport with my patients because sometimes I'll see them 2-3 times before surgery and get a feel for what it is they want and need and make sure that all their questions are answered. When you're coming in just for the week of surgery, after maybe a Zoom call, a lot of times that's just not adequate, and either for the surgeon or for the patient. So just one of those things to think about. Follow-ups are going to be very limited after the surgery just because you got to get home. Most people have flight arrangements that are already made, and if you develop any sort of problems post-operatively, that can alter your plans and can become very expensive if you're having to change flights and that sort of thing. The other problem is if you get home and have a problem, and you can't get back to the operating surgeon, it's going to be very difficult to find somebody who's willing to take care of you after another surgeon has done your surgery. And, if they do, you're going to pay for it. Whereas generally, complications that occur after a surgery are managed by the operating surgeon, and that's just part of the deal. So, there may be additional costs if it requires a return trip to the operating room, but most surgeons are going to manage, any wound healing issues or minor infections, that kind of thing, in the clinic at no charge to you after surgery. That will definitely not be the case if you're following up with somebody who didn't operate on you. So just a few things to think about, and there are different ways to approach these things. I'm not totally opposed to traveling for surgery. If you're in an area that just doesn't have any plastic surgeons, and that's what you have to do to find a good surgeon, then that's what you have to do. So that does happen, and I'm not opposed to that. But I'd be happy to discuss any of these things at greater length with anybody who's interested. I am very open about all these things when we have consultations, and I love questions. I want to make sure that everybody is completely comfortable when we're done with our consult. And if you need more time, then we'll arrange for more time. I hope to see you soon, and have a great weekend. Take care.